Cleveland Clinic agrees to fund detransition care in DOJ settlement over trans youth treatment. The Cleveland Clinic agreed to provide $2 million in detransition care services as part of a settlement with the U.S. Department of Justice over allegations tied to gender-affirming care for minors. The agreement follows a 2025 federal investigation into claims that the hospital system falsely billed insurance providers for what the DOJ described as, quote, sex-rejecting procedures on minors, end quote, including puberty blockers, hormone therapy, surgeries, and voice modification treatments. Under the settlement, the Cleveland Clinic will also pay $308,000 to resolve billing allegations, though the hospital denied wrongdoing. The hospital also agreed not to offer most gender-affirming medical interventions to minors for the next 20 years at facilities across Ohio, Florida, Nevada, Canada, the United Emirates, and the United Kingdom. Some state laws already ban gender-affirming care for minors. The clinic also said that it already provides detransition services and that little will change operationally. A spokesperson confirmed gender-affirming care for adults will continue. The settlement requires the clinic to establish public resources for detransition services, including a dedicated webpage, phone number, and care coordinator within 30 days. Trans advocates criticized the agreement. Dara Adkison, executive director of TransOhio, said, quote, the clinic is jumping to the front of the line to comply not with science and medicine, but with cruelty and anti-trans hate, end quote. So my understanding is in most hospitals, most clinics, they do not provide surgeries to minors.
Mm-hmm. Yeah.
They do provide counseling. And I think in extreme cases, they do the puberty blockers. And they do a few other more invasive procedures, but nothing like sexual reassignment surgeries. So I think that's somewhat of a talking point to try to get into the media to make it seem like it's far worse than it is. I think in most cases, I personally do not agree with any kind of surgical intervention when it comes to minors and transitioning, because I do think that there are risks that a child is not able to consent to and understand when it comes to long-term fertility, libido. Yeah. I remember watching Jazz Jennings on her documentary, and she was one of the first outspoken people about where we knew her story. And then she talked a lot about the things that she wished she didn't do when she was younger. It doesn't mean that she wasn't trans and that there weren't things that could be done.